hope to see you in Baltimore on September 8th and 9th. And now I'd like to welcome in our first guest, who is also going to be one of our speakers in Baltimore, Robin Gelburd, with President of Fair Health. Robin, good morning to you.
Good morning.
And nice to have you on the program again.
Thank you so much for the invitation. It's always a pleasure to speak to you and your audience.
Yeah, and look forward to seeing you in about 5 weeks in Baltimore as well.
Absolutely.
Hey, I know we're going to talk a little bit about, this activity around, consumer protection laws and surprise bills and emergency services. But for our audience that may not have heard you before, give our audience a little background around Fair Health, if you would, please.
Sure. Fair Health is a very unique organization. It was created out of a settlement back in 2009 from an investigation brought by then Attorney General Cuomo into the insurance industry. They were looking at the way in which out-of-network services were being reimbursed, and they found that there were pervasive conflicts of interest in the marketplace that really needed to be solved. So the matter never went to trial. All of the parties agreed that a new paradigm should be created. And toward that end, they established a new independent, not-for-profit, that's Fair Health. We're tasked with housing a private healthcare claims collection that can inform decision-making for all stakeholders around the country, for maintaining a free website to give consumers access to medical and dental information, and for making available a platform for policymaking and research to really help folks ask and answer the hard questions that are plaguing the healthcare system today.
Well, I appreciate it, and I think you guys are doing some great work. I love this topic we're going to talk about today because personally, Robin, I had an experience early this year where I had my dear wife and my grandson at Disney World, and we had an emergency situation with my wife. So I did get surprised by some of these emergency care at facilities outside of my network. And you just got to take care of the situation then. It was totally out of my hands and did not realize that was going to hit me. And so let's talk a bit about these surprise balance bills, the surprise that we consumers get, around our medical costs and what is being done.
Sure. Well, you are certainly not alone. There are two areas where there has recently been a lot of legislative attention. One is the situation that you just mentioned where someone needs emergency care, and by the fact that it is emergency, they can't really deliberate and pick an in-network facility and make choices about where they're going to go. You may even be on vacation, as you were, even away from your area of residence. And in that instance, when there is a true emergency, what people have been learning is that after the care is rendered, people have been receiving rather substantial bills for those emergency services, often treated as out-of-network bills. So that's one area of inequity that has been addressed by the legislature, where they're trying to hold consumers harmless to what would be the in-network rate of services for that emergency care. The other scenario that is quite pervasive all across the country is the situation where you receive out-of-network services, oftentimes at an in-network facility. That happened to me, for example, when I had my baby at an in-network facility, knowing it was in my plan's provider network, and then at the end of the day receiving a bill for an epidural by an anesthesiologist who was out of network. Again, a situation that consumers are not typically aware of, and so in the wake of doing their homework for that in-network facility, they can again receive sizable bills from providers who are not part of their plan's network. So those are really the two main areas that have received a lot of attention from policymakers and legislators around the country. Some states have actually already passed legislation to address some of these issues, and some are debating it as we speak to think of the right solution for their particular jurisdiction.
Now, has New York passed something? Is there a New York statute right now? Or?
There is a New York law, and actually New York really came out of the gate in a way that attracted a lot of attention. It was considered actually quite groundbreaking in its reach. Actually, the New York Times, in the wake of the passage of the bill, said it is a law that other states should look to and gain inspiration from because of the breadth of protection afforded to consumers. It was passed in 2014 but became effective March 31st of 2015. So we just passed basically the one-year anniversary of it. And what it did was really interesting. First of all of the key stakeholders were around the table as it was being deliberated. You had the hospitals, you had providers, consumer advocates, and a number of other key stakeholder groups, everyone recognizing that these issues needed to be addressed. And what they determined to do was, one, they created a term and codified it in the statute, the term usual and customary cost. And they defined it very carefully as the 80th percentile of an independent database unaffiliated with any insurer. And what they did with this term was they basically used it as a backdrop to help inform the conversations and the negotiations amongst the plan and the provider. They said if a consumer is confronted with an emergency situation or a surprise bill for out-of-network services that they did not anticipate, the consumer will be held harmless to the in-network amount that their plan would otherwise charge, and it's up to the plan and the provider to sort out what would be a fair level of reimbursement. They did not require that the level of reimbursement be at that 80th percentile UCC, but it, in a sense, informed the conversation between the two parties. If those two parties could not agree, the statute provided for a very detailed dispute resolution process that indicated that that dispute resolution entity could look at UCC, what that 80th percentile was in that particular community, to help resolve the dispute. Significantly, the Department of Financial Services, which is our Department of Insurance in New York, designated Fair Health as the only data source that met that definition of independence and lacking any affiliation with the insurance community. So, in effect, our 80th percentile is helping to inform these conversations between the provider and the plan. And our understanding is, as we pass that year anniversary, there seems to be general agreement that the bill is working. It is encouraging and leading to resolution between the provider and the plan. And the consumers, as you see, they have a blanket of protection for them, being held only to the in-network amount.
Yeah, that's very interesting. Now, has Connecticut done something similar, the way I understand it, or where are they?
Well, it's interesting. So the country is sort of acting as, I guess, the founding fathers intended, in the sense that it was always assumed that states would be their own laboratories. It was always encouraged that states should create legislation that meets the particular needs of their state. Connecticut chose to go in a slightly different direction. Their focus was on emergency services particularly. And what they did was they did not have a backdrop sort of encouraging the conversation between the plan and the provider. They actually prescribed what the resolution should be, and the insurance department of the state of Connecticut issued, a formal guidance memoranda that indicated that the healthcare provider would be paid the greatest of three amounts: either the in-network amount that plan would typically pay for that service, a UCR rate, usual and customary reasonable rate for such services, or the amount Medicare would pay. So that's basically, those three categories are in the statute, and then what the commissioner did was put a gloss on what UCR means, and they said, again, it would be Fair Health, 80th percentile, shall constitute UCR for purposes of the Connecticut bill. So again, sort of a slightly different approach, but trying to tackle some of the same inequities that patients all over the country are experiencing with respect to emergency care.
So Robin, you have a unique bird's eye view of the whole country too, Ed, from your seat. So what else is happening across the country when you get outside of Connecticut and New York, which are very interesting initiatives? What else is happening or being considered?
Well, something that we're noticing, because we are privileged to be the custodians of the largest private healthcare claims collection in the country, essentially 20 billion records for over 150 million people. So in some ways, we're like the canary in the coal mine, because we can see things that are happening sometimes before they get into full view. And although a lot of folks are talking about this, we're seeing it very crisply, is the changing dynamics in where people are accessing care or how they are accessing care. So, for example, we're seeing, material changes in the number of procedures being done at urgent care centers and at ambulatory surgery centers, and the number of people who are going to retail clinics for care. And it's interesting about retail clinics because of the de-identified claims that we see. In the past, it used to be primarily for vaccines. I know I would take my boys to, the local drugstore, to their inside clinic for a flu shot. But the claims now are showing people are having full primary care visits at the retail clinics, which is a changing dynamic. And we are also seeing, uptick in the number of claims involving telemedicine, which is really fascinating as well. Mm-hmm. So there are many different changing venues for care, and that in turn will likely bleed into changes in provider networks that plans will constitute, and so it's fascinating to see this unfolding in real time.
Yeah, it is. And I think it's all a part of this consumerism movement. Is as we put consumers out there more in front of all these claims, we need to help them, protect themselves. What can first of all consumers do to take advantage of these protections? But what can their employers do to help educate, their employees and their consumers about this?
No, that's an excellent question. You don't want this type of protective legislation to be like a tree in the forest that falls that nobody hears. It doesn't protect consumers unless they are aware of it. So I think employers can really be helpful to their employees by making available to them different educational resources. For example, our free consumer website, fairhealthconsumer.org, has educational materials about the New York bill, and we also have information about ways in which to avoid going to an in-network facility and receiving out-of-network care, or at least to be aware of that situation. So whether the employers direct employees to our site or other materials, clearly they would be doing, or providing a major benefit by making that information easily accessible. What consumers can do once they know about the bill is make sure that they fit within those protections. So, for example, sadly, what we have learned from our consumer survey is that there's still a sizable amount of people who go to the emergency room for non-urgent care. They may not be familiar with, primary care venues open to them, or for whatever reason they are going there when it is not truly an emergency. The protections in these bills, whether New York or Connecticut, will apply if it really is an emergency that you're going to the emergency room for. If you're going there for, strep throat or something that could be treated in a different venue, whether it's an urgent care center or your primary care doctor's office or even a retail clinic, consumers should know that they should really step that facility and go to another area, because otherwise they will still remain exposed to those balanced bills.
Yeah. What other, from your perch too, as we kind of come to the end of this program, what other trends do you see around transparency that you need to make our audience aware of? That what do you see emerging that we need to be aware of?
I think, we're delighted, given that our mission is to bring transparency to health insurance information. We're really, as I said, delighted that transparency is in sort of the national spotlight right now. And where we have moved is actually from transparency to clarity, because while transparency, in a sense, is the first step to make certain types of information available to consumers, you really need to move to that next level of clarity so they can really digest the information and make it actionable. And I think what you'll see in this next wave of activity is really a concerted effort to really distill the information down to ways in which consumers can use it to be better advocates for themselves. So in other words, not just providing data to them, but really saying what it means, how it could help decision making, really providing information that's geographically relevant to them, that is independent, that's conflict-free, that's presented in user-friendly, formats, so that people can really just run with it and have it be meaningful. Again, it's the same thing like the legislation. You don't want these transparency tools to be like trees in the forest that nobody hear.
Yep. I love your transparency to clarity. I think it makes a lot of sense. Sounds like an emerging article, Robin.
There's no shortage of those at Fair Health. In fact, we are thrilled at the reception that our recent piece on opioid dependency and abuse just received all across the country. It was just released last week, and you may have seen that what we uncovered is that there was an astronomical increase in the amount of services being rendered to those with opioid abuse and dependency, showing that not only is there issues at that micro level between, on the individual level, excuse me, but also at the systemic level, the healthcare system is really being really challenged with the amount of care and services to meet this growing area of concern. So there's no shortage of articles, and I'll add that to the list.
Yeah, Robin, great having you on the program, as always. Great discussion. As we kind of close this program, leave our audience with 2 or 3 takeaways, if you would, please.
Yes, I think, as I said, the audience should be aware of these burgeoning laws involving surprise out-of-network bills and emergency care, and check with their departments of insurance or health to see whether in their states there has been any movement in this area, and to make sure that they understand the particulars of that legislation so they can take advantage of those particular laws. And likewise, to really to not be intimidated by health insurance information. It can be complex. Sometimes people are very intimidated by it, but I really invite folks to come to our free website. We really put out a welcome mat for consumers so they can learn about the principles and the glossary, the language of insurance, to really allow them to be better advocates for themselves.
And again, Robin, would you share that website with our audience, please? Absolutely.
It's fairhealthconsumer.org.
Robin, thank you so much. And I want to remind my audience, too, that you can join us at Private Exchange Forum in Baltimore, where Robin will be present and speaking. And thanks again, Robin, for taking time out of your morning. Very, very great discussion. And we'll talk to you and see you real soon.
My pleasure. Thank you so much.